most aggressive of the ER-positive metastatic breast cancers will metastasize to the brain. And so this is a really important feature, particularly of these genomically unstable luminal B breast cancers. And so, ultimately, in the adjuvant setting, we're going to need better and better therapies that will improve disease-free survival of patients and prevent, hopefully, brain metastasis. So in the metastatic setting, we're very, very interested in which of these CDK4/6 inhibitors will be able to treat established brain metastasis, in the hopes that eventually these will be moved into the adjuvant setting, which they are. They're in these CDK4/6 inhibitors right now. Palbociclib and abemaciclib are in adjuvant, large adjuvant trials. And it turns out that it was initially noted in patients with glioblastoma multiforme that received abemaciclib preoperatively before they went to resection. And indeed, there's very high levels of abemaciclib that actually get into GBMs. And in fact, there's some evidence of benefit from abemaciclib against GBMs. So it definitely penetrates. Similar work has been shown in patients with breast cancer brain metastasis who have been given abemaciclib before they go to surgical resection of a metastasis. Also, high levels of penetration of abemaciclib into brain metastasis. And there has been a study that has been done with abemaciclib as a single agent, or if patients were on, an aromatase inhibitor, they could stay on it. And there was evidence of some objective responses with abemaciclib in patients with heavily pretreated brain metastasis. So this is an agent, this is something we could consider for our patients who have ER-positive metastatic disease with brain metastasis. We have very little data about agents that actually can benefit patients, but abemaciclib does have activity against ER-positive brain metastasis. We don't have data yet from palbociclib or ribociclib, as to whether or not there will be any activity. I think with palbociclib, there hasn't been data emerging that it penetrates into the CNS. And with ribociclib, I think there are some preclinical data that there may be some penetration into the CNS with ribociclib, so we await clinical data there. But it's just going to be yet another factor potentially for women with the more aggressive type of breast cancer, because it has to penetrate, and then secondly, it has to work against that aggressive kind of breast cancer. So certainly with abemaciclib, it does. Now we need to move it up, I think, earlier in the course of the treatment of brain mets with abemaciclib.
We do know that the CDK4/6 inhibitors are different in terms of not only their toxicity profile, but also the fact that ribociclib and abemaciclib can cross the blood-brain barrier. And there is now evidence that these drugs, when delivered for patients with CNS metastases, that can result in CNS responses. The data are very early, but they're quite encouraging. And for those patients that present certainly with CNS metastases, who have been treated perhaps with SRS therapy, and otherwise one is continuing to use and think about using endocrine-based therapy, a choice such as abemaciclib or ribociclib would make quite a bit of sense. As I mentioned before, patients who present with bone metastases, long treatment-free interval, these are patients that we know still benefit from the CDK4/6 inhibitors, but there is clearly a group of patients that we should never, based on the data right now, withhold CDK4/6 inhibitors, and that's those patients with these very high high-risk clinical characteristics, such as liver metastases.
The other area of interest is the management of brain metastases, because although this is relatively rarer in ER-positive breast cancer, hitherto we've been concerned that an endocrine-based approach is an unlikely way of managing these patients. However, we do have data with abemaciclib that it may well cross the blood-brain barrier. There may be some penetration of CNS disease with this drug, so there may be evidence that it could be an effective combination systemically to use in patients who are presenting with some degree of brain metastasis spread.